My name is Dr. Joan Chan. I'm a family doctor here in Guelph as a part of the Guelph Family Health Team. And I'm also the physician lead for the mass vaccination site that's here at the University of Guelph. I've been planning this for over a month and I've been excited and thinking about it on this big scale, but it didn't really hit me for some reason until I was sitting in my chair and the first person's walking towards me of like, oh, I'm literally giving people this vaccine today. Public Health, they have established the model of how to do a mass vaccine clinic, and they've been amazing at sharing everything that they've learned and done in the ones that they've set up. But University of Guelph being intimately involved in each of those meetings as well, since they are literally housing the clinic as well as staffing big portions of it. And they've been incredible to work with. I think there are things that our clinic was able to have from day one because we had this unique partnership. So, for example, through working with the utilities team here at U of G, we have a specific flow. If people don't speak English as their first language, they won't feel so disoriented going through this mass vaccine clinic experience. My hope is through clinics like this, conversations that we're able to have with our patients, we can help reestablish trust through this point of connection. It's just so special that people are taking time to come and be vaccinated so that we can end this pandemic and people can, get their freedom, get their lives back together. That's been really rewarding. The check-in and check-out staff, so the actual administrative staff, they're students from here at the university, and that's being funded by the University of Guelph. Volunteers are a major part of this clinic for sure.
So my name is Caitlin. I'm in the Masters of Applied Nutrition program. My role in the clinic is helping with checking the patients in to go for their vaccine and then making sure that they're feeling well and checking them out.
My name is Guire. I'm in my 4th year of biomedical science. We help people into the building, help people to direct them from the parking lot to the entrance, kind of help them move their way through the clinic from the check-in process to the vaccination process to the kind of monitoring process afterwards, and then all the way through to checkout and back to their vehicle.
I think it's really great how they've rolled everything out, and they've been able to do a really great job organizing it.
Definitely just an opportunity to be a part of the solution to this kind of horrible thing that's been happening for the last year and a half or forever as it feels. People are always very, very happy to have gotten their vaccine, and that's a really rewarding experience knowing that you've been part of that. So seeing people come out of the clinic, happy and excited is definitely the best part.
The main things I say is, I didn't become a physician to harm people. I didn't become a physician to give people things that would hurt them. I've done my research, and I know people much smarter than me have done a lot of research. The eyes of the world, the scientific community has been focused on these vaccines and making sure they are safe and they work. And I do trust what's come out about those things. This year has been a nightmare, and it's hard not to be uncertain and fearful of yet another thing that you have to make a decision about, especially when there's a lot of misinformation, especially online. I got it for myself, but more than that, I got it for my patients and for my loved ones, because if I spread it to those that I love, they are more likely to get those complications. So this is like a collective community effort. We need to end the pandemic and to keep each other safe.